Patients roaming the halls, no nurses in sight. That's what firefighters reported at a Chelsea nursing home this weekend. Investigative reporter Ted Daniel got a tip about this story. He joins us live now in studio. And Ted, a visitor sounded the alarm.
Vanessa, a visitor called 911 with concerns about an elderly woman who needed medication, insulin. When firefighters first arrived, they say they couldn't find any medical staff. The state health department was notified and sent a rapid response team to the facility. Residents on the move, others relaxing outside. That's what 25 Investigates found at East Point Nursing Home in Chelsea when we went to learn more about what happened here Saturday afternoon.
Response to East Point Nursing, 255 Central Ave for the medical aid.
This report says Chelsea firefighters were called to the third floor for an elderly patient who is diabetic.
They're stating neglect. An older female there was neglected and did not get her insulin shot.
That wasn't the only problem. According to the report, there were 5 to 7 patients lined up at a medication cart waiting for their medications. Firefighters were initially unable to find any LPNs or RNs on that side of the nursing home, with multiple patients roaming the hall. When a nurse was located, he told first responders the nurse assigned to that side of the floor had left after working a double shift. There was no replacement. He said he was responsible for his patients, and if he had time, he would go to the other side and give out their medication. Firefighters reported triaging patients on the third floor. One was taken to the hospital by ambulance for back pain. What did you say the biggest patient safety issue was now?
Staffing shortages.
Dr. Heidi Coomer of Boston is a critical care physician and president of the Patient Advocate Certification Board.
You had a nurse who worked 2 shifts back to back, probably not planned, probably stayed on because there was nobody to cover. But after 2 shifts, you yourself aren't safe anymore.
We went to East Point to get answers. The healthcare group that owns it responded with a written statement. Part of it reads, Advinia Care East Point had a staffing challenge on a shift this past Saturday, which was addressed very promptly on that same day. Staffing has now stabilized in the building. Despite the situation on Saturday, all residents received proper and necessary care. And the state health department says members of that rapid response team are still assisting at East Point. DPH has launched an investigation. We'll let you know what comes out of that. For 25 Investigates, I'm Ted Daniel.